So welcome everyone. My name is Catherine Brentnall from the Manchester Metropolitan University, and it gives me a great pleasure to welcome you to the latest seminar session from the Enterprise Educators UK Sustainable Society SIG. And today we've got a presentation from Dr. Sunil Kunamanini from the University of Manchester's Massoud Entrepreneurship Centre. And Sunil is a senior lecturer in enterprise and entrepreneurship and has been championing social and environmental entrepreneurship in his teaching, mentoring, and research. If you were at IEEC in September, which was hosted by MMU, there was a real revelation at that conference about the importance of, but almost an entire lack of cooperative and democratic enterprise education and support. So Sunil's focus on commons thinking really bucks this trend, as it provides the philosophical and ethical foundations for the development of more democratic enterprise. So thank you so much, Sunil, for this really important session to kick off our 2025 seminar series. You take it away.
Thanks, Catherine. Thank you so much. Just as a start, we can keep this very interactive. I've got loads of slides, but I don't know whether I'm going to finish them, but we'll see. And we'll keep it as interactive as possible. So feel free to, ask anything in between. That's absolutely fine. So I'm sharing basically it's about healthcare. This is this whole philosophy that I'm going to share with you today emerged from a course that I've been teaching for 4 years now. It's kind of developed over time. Started off with a lot of ideas around venture capital and stuff, but kind of gradually progressed into more commons thinking. So it's got a lot of focus on care, commons, public value. But importantly, what I've realized is when I'm especially doing systems thinking, it can just get, out of control, because systems thinking can, you can have as many loops as possible, as many nodes and as many elements as possible. So it can get a bit out of control. So how do we, for me, the big question is, I want to teach this. I really care about it. I really care about common. I think every student should really understand this. But how do we keep the stretch for students without overload? And that's we all want to teach sustainability, but how do we teach all the tools without that overload? So what I really want to cover in this presentation is set out the core ideas. I've got 5 core principles that outlines the underlying philosophy. And then I've got 5 tools. So 5 core philosophical ideas and 5 core tools that I want to present, and then explain. So this is part of a project I'm doing. It's kind of internally funded by the humanities division at my university, as part of a teaching and learning enhancement project. And I'm really changing assessments, and the whole course is driven largely by assessment. So I'm changing for next year, and you're like the first people I'm presenting my ideas to. I'm slowly conducting a few focus groups as well with previous students. Got an RA to do that stuff, but I've got some underpinning ideas that I've been developing, and I want to share that with you and see what you think about it and whether you'll adopt it in your course. And if you've done similar things, and if there's anything you want to share with me, that would be fab as well. So I'm changing things, and I want to make it more inclusive, and make sure the workload feels fair across different student background. Just to give you a bit of a background, some of my students did astonishingly well with the stretch. And this is the first time, and I've told Catherine before, the first time I've actually given a few hundreds, I've had good unsolicited feedback on LinkedIn, and people have said, they really enjoyed the stretch. But I want that stretch to apply to every student, not just a few who score 100. So, very positive feedback, but what I really want to do is improve the design so the stretch is available to all students, not just those fluent in academic or kind of design heavy formats. So why change if it's already working? Because as I was saying, I think every student needs to do the deep thinking without getting stuck in that cognitive load. Cognitive load really comes from very prescriptive style of teaching, formats, templates, a lot of admin, a lot of spreadsheets, and all those stories can also get a bit glossy rather than deep thinking. So I want to encourage, the aim is to make reasoning visible and shareable, but not heavy and cognitively, too much. So why this? Why now? Healthcare. I'm very passionate about it uh, from a personal family perspective. There's a lot happened in terms of healthcare needs in my family, so I'm quite passionate about, and I'm seeing healthcare in developing world and in the developed world. So I really care about it. But unfortunately, what's happening is there's a lot of evidence that links private equity to worse patient outcomes, and I've seen firsthand how commercialization of healthcare has impacted healthcare in my own family and relatives. So there's ample evidence. For example, the FT article that says pursuit of profit bodies ill for U.S. healthcare. I'm not really talking anti-enterprise here, but it's really widening what counts as value. And now, in fact, interestingly, California now reviews private equity in healthcare acquisitions as a result of this lowering of quality of healthcare as a result of private equity. In terms of UK, we've seen excessive pricing cases, that epilepsy one, for example, which is on the screen there, on essential medicines. And even within the NHS, market powers and incentives, they can clash with public value. So recently, the UK's Competition Appeal Tribunal fined Pfizer and Flynn for excessive pricing. So it's kind of a reminder that profit first logics can even undermine access, even in something like the NHS. And VC and valuations in life sciences, post-pandemic, so much boom, and especially with COVID vaccines and stuff. And then there's been a slump, right? And that's left funding more selective. And big rounds of venture capital, they just push high valuations, while many really worthy community type projects struggle to raise any money. And my fourth point really is the global contrast. We see, I mean, I come from India, and I've seen in lower resource settings, care innovations often rely on commons-like models. A classic example, which I've given many of my teaching, is Arvind Eye Care, where the rich actually subsidize the poor. Everyone gets the same level of surgery, and the poor, in fact, get free lodging, free transportation, but the rich kind of subsidize it. So there are viable paths beyond pure venture capital scale. So in teaching, how do we center care, commons, public value, and give students tools to handle a lot of complexity without overload? That's the big thing here. We want to put care, commons, in front, public value in front. And I really want to use light. I've got loads of tools to give to my students, but I want to use lightweight scaffolds so students can actually engage honestly. They can think deeply without getting lost in spreadsheets and complex systems and all those impact calculations and lots of numbers without drowning in it. So how do we do that? And that's my main goal here. So I've got, as I was saying earlier, I've got 5 philosophical core principles, and I've got 5 core tools. So I'm going to set these 5 ideas, it's the spine of everything that I do actually. And that's care, it's commons, it's public interest entrepreneurship, post-growth, enoughness, and finally, obviously, what we've been talking so far, it's the stretch to give students without the overload. And why do I say plain language? Because if we can't explain these ideas simply, students can't use them, So the aim is to, and the testing ground for me here. So tell me if anything is complex, and then we can have a nice chat and discussion about it. So the aim is to really make the thinking visible, shareable, and it's not to impress people with complex, high-flying vocabulary. So as I talk about the core principles, please think about your own courses, modules, and where each idea can, change a brief, a rubric, an assessment design, a habit among students, or a habit with you. So you don't need to adopt all the ideas in the toolkit. These are core philosophies I've developed over many years. So, a well-placed idea perhaps can shift a course. So please do feel free to share. I don't want it to be just me talking through, I want it to be a proper shareable discussion. So the first idea, the first core idea is care. So the way I frame this is, before asking what's the market, we need to ask who's caring, who pays, right, and who strains the system. So this kind of shifts the focus from a product to service alone, because when I was teaching healthcare, everyone was thinking in terms of devices and, commercializing devices, medical devices, for example. I was frustrated by that. I wanted to change that focus from medical devices into something more fruitful. So this kind of thinking shifts focus from the product to service to people and systems that hold everything together, actually. It could be unpaid carers, overworked professionals, under-resourced communities. So in the UK, we've got this, the NHS has got the social prescribing link workers, right? So they help people whose needs aren't just medical. They connect them with local community groups, housing, could be welfare support, volunteering, nature-based activities, right? So essentially the process there starts with one simple question: what matters to you? What matters to the users? And it's kind of co-creation, builds a co-produced plan around it. So essentially this approach centers dignity, personal choice. It kind of strengthens community connections and just reduces avoidable pressure on clinical services. And I think that's the problem. You have all these long NHS queues because of pressure on the clinical services team. So social prescribing, therefore, seems like an amazing alternative intervention here, which is led by the users, led by the communities. And why it matters to the students whom we teach, when students apply a care lens, they stop assuming that more services is better, right? Or more products is better. Instead, they learn to design ventures that recognize all this invisible care work, and reduce strain on people and systems, and prioritizes inclusion, prevention, and measures value in in terms of human and social well-being, not just services and transactions. So in that sense, I feel like care is a very important part of the spine of what I teach. The second one, obviously, this discussion is all about commons, and it's kind of the umbrella thing that holds everything else together here. And commons is something we share and we take care of together, right? It could be data, it could be knowledge, it could be community spaces and assets. So what makes it work isn't the resource itself, isn't just the data, knowledge, or the space, but what makes things work is the rules and relationships that sustain it. So good commons have clear boundaries: who is in, who is not. It has local rules, right? It has monitoring. It has fair ways to resolve conflict. And a good example from the UK really is the UK Biobank. And it holds de-identified health, lifestyle, imaging, a lot of genome data from 500,000 volunteers, and it's governed for public interest research through strict access controls, and there's a lot of oversight around the biobank. So the success of the biobank lies not only in the amount of data it holds a huge amount of data, but it's about the trust. It's built to a lot of safeguards, and there's a lot of transparency where exactly your data is being used. But at the same time, it does raise real questions about governance, accountability, potential for misuse. Obviously, these are topics worth discussing. Obviously, anything community-led, anything commons in commons data, we'll have all these issues, but these are things worth discussing. But obviously, we need a way to question the status quo as well. We can't have the rich getting richer and everyone else suffering. So where is that sweet spot between, open data, for example, and venture capitalists just, venture capital funded unicorns just making all the money. So yeah, we need a very more strategic approach here. So why it matters really when teaching to students. So thinking in terms of commons helps students design ventures around stewardship. And I think that is a very important perspective, not ownership. It's not about hero founder kind of thinking here. It reframes innovation from, how do we monetize data to how do we share value fairly, especially and while protecting rights and trust. And it also reminds us that commons doesn't mean free for all. It's about governance, right? It's about stewardship. So my third philosophical point is public interest entrepreneurship. So public interest entrepreneurship, it's really about creating ventures and initiatives that are designed to serve three important things. It's access, it's about equity, it's about system benefit, not private profit. Okay, financial sustainability still matters. I do teach a lot of finances in my in every course that I do here, particularly the healthcare unit. There is a lot of numbers going on there, but it's a means to an end. I think that's the important thing. I'm not refraining from finances. I have a very engineering mindset because that's my training. So I do teach numbers, but it's a means to an end. It's not the goal in itself. So the focus is on solving problems that markets overlook, or where exclusion has become just a normal. A really good example that comes to my mind is medicine's patent pool. It's backed by the UN. It's a non-profit. It negotiates. What it does is it negotiates voluntary, non-exclusive licenses with all the big pharmaceutical companies. And then these licenses allow multiple generic manufacturers to actually produce and supply medicines in low and middle income countries. So what's the result of that? There's a greater supply of medicines and life-saving medicines, and there's healthy competition, and it means lower prices for patients and health systems, and continued assurance of quality, because the UN, because as a middle person, medicine's patent pool acts, ensures that there is quality as well. So it's a practical example, of how intellectual property can be managed for public value, not just private control. Otherwise, what happens is you just use it to stop others from producing stuff. IP is really an exclusionary thing, isn't it? It excludes everyone else from making your stuff, and it keeps your status quo. So instead of that, let's use IP for what it was designed for, for the benefit of society. That's the entire idea here. But there are tensions, it's not free without its tensions. Voluntary licenses are powerful, but they're not perfect. They still depend on the goodwill of patent holders, and the scope of, whatever terms are being negotiated. In fact, Medicine Sans Frontiers, it argues that, it depends on which drugs, which countries, what conditions, you know, are we talking about? These things deeply affect who ultimately actually benefits from it. So why does this matter for the student? It matters because public interest entrepreneurship helps students think beyond the hero founder model, right? It shows that system change often happens through collaboration, governance, and fair design, not just new products and new services. And the question shifts therefore from can it scale profitably to can it widen access and strengthen the commons? So instead of pharmaceutical companies holding patents to stop others from using it, let's open it out and let's make it more accessible. So that was my third point. The fourth philosophical point, really, and the image you see there is the Jaipur foot. It's such a low cost one. It saved so many, it helps so many people in India, actually. It's quite an old initiative. It's been there since I was small. So, I'm almost 50 now. I'm 50 now. So it's been there for ages. And they've done great humanitarian work in supporting many people who have lost their feet. Lost and and have been disabled as a result. So the plain language here is post-growth innovation isn't about rejecting technology. It's about right sizing it. It challenges the idea that progress always means more features, more growth, more consumption, right? Instead, you're valuing accessibility, long life, repairability, designing what's enough to meet real needs in real context. So the Jaipur foot here is a very simple thing. It's not a hi-fi, kind of prosthetic. It's a very simple prosthetic, but it saved many people's lives. It's benefited many people. And there are many such examples. There is the Equalize Health Initiative. They do phototherapy for neonatal jaundice. It just costs $400 instead of thousands. Easy to maintain, and it's already supported, I think, 500 or 600,000 babies. One classic example is how GE, the ECG, they took the large device and made a portable one. Of course, now portable ones are quite common, but we're talking 20 years ago when it wasn't so common. And battery-powered ECG, which was built for power cuts and rural clinics, right? Reliable diagnostics without the massive big city hospital budgets. So there are some tensions, of course. Frugality can be discussed as, oh, just because it's low cost, you might say, oh, it's low tech, it's for the poor, right? But what you need to think is these innovations often outperform even high-end models on reliability and cost effectiveness. So the real challenge is scaling, right? How do we benefit a lot of people? I think that's the real challenge here. So again, it shifts the lens from a student's perspective. It's no longer about hero founder unicorns, right? It's about access. It's scaling. There is scaling in it, but it's cost effective scaling. I think that's the important thing here. And these are very reliable. So it is scaling without drifting back into the same wasteful growth first logic. And why it matters to the students is post growth design reframes entrepreneurship as stewardship. It's about solving problems without planetary and social limits. It's frugal. It's not placing a lot of stress on resources. So it reminds students that impact isn't measured by capital raised, right? But by actually the number of people you reach, the care you deliver, the amount of waste you avoid, and basically, access expanded without wasting stuff. So it asks a new question: what's the smallest thing we can build that makes the biggest difference? And that's why I love frugal thinking. It's frugal innovation, and it's core philosophy, therefore, of my courses. The final one is final philosophical is the real thing we're talking about today. How do we do all this for the students without overloading them, thinking deep, but tasks light. So very often our courses reward busy work, performance of expertise, long documents, big heavy templates, polished prose. They look productive. Some of my students who scored 100 or 90s in the past assessments had amazing glossy stories to say. and complex calculations. They even outsmarted me in terms of their analytical lens around how they did the calculations and how they made some of the assumptions around the calculations. But the deep thinking, the deep reasoning stays hidden, right? Overload pushes them to play safe, reproduce jargon, and avoid ambiguity, the very ambiguity that kind of the tensions healthcare demands. So the principle here is stretch comes from conceptual difficulty, not administrative difficulty. We want students working at the edge of their understanding, where ideas are just hard enough to kind of change how they think, not hard in ways that waste effort, like a lot of extraneous load. So I want to, in a sense, what I'm doing is the difficulties need to be desirable, not destructive. So for me, what overload really is, it's cognitive bandwidth eaten by the wrong things, formatting, second guessing criteria, chasing pseudo precision. And if you give them numbers to do, they'll just try and make it as precise as possible. And I use engineering models, I use quality function deployment, I use analytical hierarchy process, right? It just makes them chasing pseudo precision, right? Or navigating unclear briefs. That happens very often. So when that happens, students can't hold the system, the ethics, the trade-offs in mind. So they default to tidy answers or single solutions. So what stretch really is it's engaging with multiple truths at the same time, patient benefit, carer burden, medical staff capacity, incentives, IP, equity, things that I've just spoken. So it is the predictive discomfort. I think you need to make them uncomfortable. And it has to be productive. So they have to name the trade-offs. They have to defend them, right? And they have to see systems and commons. You can't, once they see it, you can't unsee them, right? So I used to do task-heavy stuff. Now I've converted all my tasks into light scaffolding, right? But it's not dumbing down. It's removing noise. So the signal is audible. Students can think deep. Minimal artifacts make thinking inspectable, and we can actually see what beliefs drives the problem, right? The trade-offs they're making, the assumptions they're willing to own, and I think that kind of transparency, dialogue, feedback is important more than just box ticking precision. My courses are very tools led, and I'm sure Catherine knows this very well, and Umbrin knows. I don't know if Umbrin is here. Umbrin knows that very well as well. But I think I want to not just go towards the competencies. I want to bring competencies and critical thinking at the same time. And I think that's my dilemma. That's my tension. How do I do that? So the stakes here, in the effective stakes here, overload breeds anxiety and perfectionism, which narrows curiosity. Light bounded tasks, are a reduced threat, so students can actually take intellectual risks and say this is the constraint that bites, or here's who loses in my system. They're not just thinking the primary user, they're thinking all the stakeholders. They're truly thinking systems, right? So it's also about justice and inclusion in a way. Heavy formats reward prior cultural capital, fluency, academic writing, time, design, software. All of that can be done with ChatGPT these days. So tasks light is an equity move. It levels the playing field. So marks track quality of thought. A lot of the scaffolding activities actually happen in class, and they have to capture that in class. And so it tracks the thought rather than free time polish or confidence with institutional codes and procedures. So why this kind of aligns with commons and public value? So the common depends on shared understanding, shared standards, not heroic outputs. I think that's important. So I mean, if it's all about the best performative marks that we reward, right? Then we are just cultivating that hero founder entrepreneurship thing that I'm so much against in my teaching. So I don't want to do that. I want to level the playing field for everyone. So when reasoning is compact, it's visible, um, it can be shared, critiqued, and reused, and knowledge becomes a resource that the entire class can use. So even though they submit individual assessments, a lot of scaffolding that happens in class is group, is collaborative. Many of them are working on the same problem. They design the problem, and then they continue to work on the same problem for the summative assessments. So then classrooms start to behave like public interest infrastructure rather than private performances. And how it feels to a student, I'm stretched by the ideas, not swamped by the admin. I can name my trade-off and defend it. I know why my choice is fair. These are the things that might come in students' minds. My work looks small on the page, but big in the head. Right? I think that's what matters. We often argue a lot of students have loads of good ideas, but they can't put it in paper, right? And how do we do that? So bottom line, stretch without overload. It's a stance. It's designed for conceptual friction, ethical clarity. Strip out all that tool heavy, precision heavy load, and make reasoning public. And I think that's how we graduate people who can handle complexity and care. Catherine, how much time do we have? I think I've just taken a lot of time with the philosophy itself.
Oh, no,
So
it's really interesting, Sunil. We're on 1:36 at the moment, so 24
yeah,
minutes left.
right. 24 minutes. I mean, I don't want to take up all the time because I want to open up discussions as well. I was just thinking, I mean, I can share the tools quickly and then what do you
Uh,
say?
to to be honest, one of my questions that I've just written
Yeah,
down was, how do you make the reasoning visible? And you were just talking about these light touch scaffolding tasks. I was
yeah.
like, so I'm really interested in the tools.
You're
Go, go,
interested in the
go with the
tools.
tools.
Okay,
I want to see
cool.
the tools. Yeah.
Yeah. So I mean, we've set the philosophy. Now I just want to quickly show the toolbox. So and the flow is simple, basically. Map the problem, choose a first move, test it, and then decide the IP ethics um, kind of stuff. So let me just go to the tools quickly. My first tool really, and some of you've seen this kind of thinking that I've shared on LinkedIn, and uh, it's the 3D business modeling. That's my first tool, and of course we've got the classic canvas, which is the Osterwalder one, which is great for launch plans, customers, channels, revenue, but hides the public system, the NHS, pathways, unpaid care, shared resources like data, community spaces, volunteer networks. So our 3D story, my 3D story kind of brings those into view. It's very simple. Who benefits now, right? Not just customers. Name patients, carers, staff, community. Say basically what improves today. Is it access, dignity, time saved, safety, right? The second D is deliver value. What changes in the system? This is where I bring in the systems thinking later on. And it's, naming the roles, the incentives, the shared assets that can make the benefit reliable, right? This is where the commons also shows up. The systems thinking shows up, the commons thinking shows up. And it could be things like shared clinics, community partners, and the final D is demonstrate impact. What lasts over time? So public outcomes, equity, avoidable admissions, right? Could be carbon saved as well through frugal innovation that I just talked about. So it says how you'll notice them with a couple of simple signals. And I've got a whole impact toolkit as well. So what this reveals that the canvas, what this reveals is the stewardship that, that the Osterwalder canvas misses. Who looks after the shared resource, right? And it also talks about the externalities that the classic canvas misses. Who pays hidden costs? Carers time, staff burnout, you know, and it also looks at the non-market value. The Osterwalder canvas is heavily focused on costs and revenues, right? So access for non-payers, equity gains, lower administrative burden. So, those are the kinds of things that a 3D business modeling is really capable of looking. And my second So this is an example I had actually, but I'm just going to skip the example. I think, because we don't have a whole lot of time, but the community dental van is a great example of that. I'll happily share the slides and you can look at the examples later on. Okay, now the second tool I want to talk about is the systems thinking. This is what my students did earlier, right, in my previous ones, and this is on the 10 credit module, and this one which they do for their own opportunities, individual opportunities, is common for the 10 credit course and the 20 credit course. But hey, the 20 credit course get to do an extensive, complex systems thinking for a case I give them. So this case you see here is on the GP crisis in the UK, and there was one case I gave on oral cancer in India as well. And this is really complex systems thinking they do, serious systems thinking, right? And there's careful evidence hunting. There's a genuine ambition there. But what we didn't fix, obviously there's so many nodes there, and people think lots of nodes, more complexity, better mindset, right? It becomes a precision theater, huge spreadsheets, complex diagrams, polished prose hiding the thinking. So I want to change that, right? So I want to make smaller artifacts, clearer caps, reasoning that's made very visible, same stretch, but less cognitive load, more inclusive. I think that's what I want to aim at. Lastly, the commitment was fantastic. Deep maps, careful references, real ambition, but you can see the whole load with the systems map. It just gets out of, man, where do we intervene? That's the main thing here for me. When you're doing systems thinking, it becomes a sprawling diagram, a lot of polish that hides the reasoning and hides clear interventions. And students felt busy but not brilliant. Okay, so I'm moving to deep thinking, but tasks like. And this is what I'm doing now for systems thinking, keeping just 2 loops. Okay, so we map just enough of the system to see where a shared resource, that is the commons, can change the pattern, not draw a masterpiece complex diagram. So why 2 feedback loops when a 1 loop confirms what we already believe, but 2 loops force us to notice both a harmful cycle, where the pressure grows, and a helpful cycle, right, where the pressure eases. So what, how that points to a commons move, because we're talking about commons really here. So once you can say the 2 loops in words, ask which shared thing, right? Could be data, space, it could be a protocol, it could be a rota. Which shared thing can be strengthened or governed differently? And what would weaken the harmful cycle and what would strengthen the helpful one? So that shared thing is the intervention point. Keep things really simple. Stay with the problem, no early solutions, right? Devices, apps, great. As soon as we ask students to do things in the class, they just jump to that solution mindset. But mapping simple things first shows when a simple change in rules, roles, shared resources will beat a shiny product. So what a map. I mean, I'm suggesting the 6 to 8 nodes here, right? 3 constraints. The constraints are usually rules, incentives, resources, culture, behavior. Those are the usual constraints, and just 2 loops. One harmful, one helpful, right? So so what constraints really mean? I just want to come to this constraints thing. So the rules, for example, it could be rules or incentives. It could it could be contracts or protocols that shape behavior. For example, in the UK we have community pharmacist consultation service, right? So how do we make rules that are inclusive of them? And the second constraint, usual constraint, is the capacity resource. Staff at 8 a.m. to 10, 8 to 10 a.m., consultation rooms, when are the staff really free, right? And the other one is culture behavior. Pharmacies are available for consultation, but we still have this thing, doctor first expectation, right? Reluctance to use a pharmacy. So that kind of gets in the way. So constraints aren't really excuses. They're design rules that, you must respect and deliberately change. The one I really find difficult is the culture one, right? We still want access to the GP, not the nurses. right? The nurses are sometimes more capable than the GPs, right? We don't want access to the pharmacists. We just want to go to the GP first, and that's a really difficult one. So just as an example, the systems I have is one of same day GP access. So the harmful cycle is phones jam, long queues. People just walk in, and then that stretches the staff, so the staff is slow, then more people call again. But a helpful cycle is handled by pharmacy. GP time is freed for the critical cases, faster callbacks, right? And then there's few repeated calls, right? So the commons move is a shared rota, a triage script, right? A shared local service directory across practices, which can route very simple cases to the pharmacies. Okay, um, so then the whole system can actually breathe. I think that's the point here. So what we're doing here is we're distinguishing the pattern versus the solution. So pharmacy first contact, it's a pattern, right? It is the one from a cultural perspective, it's difficult to overcome. And the solution is the bundle that makes it reliable. Shared access hub, one triage script, outcome nodes, basic data sharing. You only send the simple cases to the pharmacies, right? And that way you up the trust that people have in the pharmacies and not just expect the doctor first, the GP first thing. So that's a common solution. Create rules, roles, resources, right? So if we can't describe 2 loops and 3 constraints, then we don't understand the problem. You can do all that complex mapping my previous students did, but you might still not understand the problem clearly, because if you don't find that intervention point and don't find that one shared resource that can change or flip the pattern, right, then you've really not understood the problem. I think that's my problem here, and that's why I'm changing things. The third one that I really like is the QFD stuff. It's a very small, honest way to turn needs into choices. It kind of shows who benefits, who waits, and why this first. Can we actually test it in the next 60 to 90 days and not write a thesis, right? And where it actually comes from is it has roots in engineering analysis. Okay, I used to run the whole big tool before, lots of weights, correlations, numbers, matrices, Excel stuff. It looked very rigorous, and it got but it really buried the thinking. Students optimize a spreadsheet, not a service. And I'm trying to make it really light. I borrowed an idea from there, but I want to make it quants plus qual both. So it keeps the discipline, the trade-offs, right? The judgment, the difficult decisions that we have to make. Healthcare is complex. You can't just make a decision with some numbers, right? And it dumps that numbers precision baggage of the students. So what counts as an option? Not just gadgets. Think service features and sequencing, right? As I was saying earlier, a shared triage, a script, pooled rota, right? These are important things, right? So it's not the big maths that matters here. And can we make it actually simple? So my students used to do this before. This was complex, right? This is a lot of modeling is happening here. They're using some complex engineering tools. Some really got it, some really did well. I presented them in a very non-engineering way, but I think not everyone really got it. But what I'm trying to do now is make it really easy here. Just give them some simple, some simple trade-offs to think about. Clear needs and clear options, right? So in this case, for example, here, O1, which is the pharmacy first contact, it's just continuing from the previous examples there actually, about GP access. O1 just edges O2. So we can start with the pharmacy first contact and clear simple demand and protect the non-digital access as well at the same time, right? And line up a nurse block next, if the pharmacy doesn't work, to lift continuity. So why this kind of decision helps, it keeps the stretch in the judgment. Some numbers are useful, right? But it's not spreadsheet gymnastics. I'm not doing what I did in the previous slide. It puts the trade-off on the table. Who benefits, who may wait, and why that's fair, right? It treats commons choices, the pharmacy first, shared with the GPs, right? It treats that commons choices, the shared rota, the shared protocol, the shared room, right, as real options, not just gadgets. And I think that's where the difference here is in this kind of QFD light thinking. So, and I think it helps the deeper thinking actually in that sense. So if two options score about the same, then the tiebreaker isn't more maths. And I think that's the thing to think about as well. It's equity, it's feasibility, it's staff readiness. Then that's where the qualitative stuff kicks in. It's about stewardship of shared resources. Again, the commons thinking, right? So yeah, that's the QFD line. I mean, I have a lot to talk about, but I'm just cautious of the time here. And finally, the impact is also important. So what I mean by impact, again, is not a glossy story or a huge spreadsheet. It's a clear line of sight. I used to do a lot of complex things. My students did a lot of complex things. They used to do what is called as the social return on investment. Some got it, some didn't get it. They used metrics like QALY and DALY. Essentially, it's QALY is quality adjusted life years and DALY is disability adjusted life years. But essentially, what it is how do we make people more healthy? You know, how do we make people make more healthy choices? So impact needs to be a clear line of sight from what we change to who is better off, who is more healthy, but how much in the real system, right? And the common step here is, again, name the shared thing we are strengthening, a shared room, a shared data set, and who looks after it. If no one stewards it, nothing sticks, right? So we just need one number, not all those complex SROI calculations and more cost effectiveness calculations. The medicines body here, NICE, which approves drugs, loves this QALY figure, but it in the classroom it doesn't help with the systems thinking, right? So we just need one honest number in human terms, okay? A number that anyone can grasp. Cost per problem actually solved, cost per person meaningfully helped, or cost per hour of staff time freed. That's enough to compare options without pretending to precision we don't have, you know. And precision can make the student lost in it, right? So we need to explain these things clearly to them as more healthy life or less unhealthy life across the community. Again, the common thing here, we're not pricing lives, we're using a fair yardstick to actually compare choices that affect many people. Again, the scale thing that comes in, when you're thinking about commons, you also need to think a bit of scale. So what's really changing? I used to ask for detailed well-being price tags and long chains of impact calculations. It looked exact, but it hit the judgment. And from next year, I'm asking students for one honest number, two plain assumptions. So we reward clarity and integrity, not Excel tricks. And the final one, again, I'm going to skip the example there. I'm happy to share with you later. The final one is about IP and ethics. The point of IP in health isn't to win a moat, right? It's to advance care. Exclusive rights can be a useful incentive, but the public bargain only holds if society actually gets better access, better outcomes, and learning we can actually build on. So where I've shifted, earlier in my teaching, I treated intellectual property as a neutral box on a canvas, right? File a patent. Now I ask, what is the IP structure doing to the system? Does it speed diffusion, slow it, right? Does it invite collaboration or lock a basic know-how? And in medicines, we repeatedly see there's this thicket, there's evergreening, right? So we see dense estates built from incremental claims, right? So, it could be a small formulation tweak to a drug. It could be a new delivery device. So they just claim the entire thing, the company's there through small incremental innovations. Sometimes that reflects real hard-won improvements, but mostly it just defers to competition. So I don't therefore ask to students to take sides. I say to them, look, what's the mix of claims? Who's excluded? Who benefits, right? Therefore, I actually value groups like IMAC. IMAC is a great company, and I have a look at it. It's a charity. They surface the public interest view on patent estates. And the industry always pushes back on their counts and methods, and that's a real tension. The tension is healthy, and there are patent search tools like lens.org, which I used to use, and you can actually see the landscape, and it's good. Instead of just debating in the abstract, you can actually look what's happening. And I want to continue using those kinds of tools in the classroom, but I want educators and students to form a view with open evidence, not press kind of releases. So the commons option, again, the shared infrastructure, who benefits, what's being shared, what are the open methods in these patents, what is the data commons in these pooled intellectual property. It's not about layering exclusivity, right? It's not about abolishing profit. It's rebalancing it towards stewardship and access, and make public value better. So that's my fifth tool, really. So, Catherine, I'm going to finish, not on time. I had 2 more slides for reflection, but that's fine. The 5 core philosophies and the 5 core tools and thinking. I think I've laid it out clearly here. I hope it was clear. You're on mute. You're on mute, Catherine. You're on mute, Catherine. You're on mute. Catherine.
Thank you.
Oh, yeah. You're on mute.
Yeah, no, thank you. That was brilliant, Sunil. And I just wanted to pause before the hour is done to give people an opportunity to make any comment or ask a question. And while they might be gathering their thoughts, I've got a question, because I know that you did a toolbox a while ago